Hi, sir. Good afternoon.
Hello, sir. How are you?
I am good, sir. How are you?
बहुत बढ़िया.
So, yes, we'll just start in a minute, sir.
ये इस पे YouTube पे स्ट्रीमिंग हो रही है?
YouTube पे स्ट्रीम हो रही है, सर. मैं आपको YouTube का लिंक में भेजा तो है. भेजा नहीं क्या मैंने? एक सेकंड में आपको YouTube का लिंक भेज देता हूँ. Yes, sir. Yes, sir.
Okay, sir. तकरीबन 187 लोग जुड़ गए हैं.
हाँ, काफी सारे लोग हैं और काफी सारे लोग जुड़ने बाकी हैं. अभी जुड़ जाएंगे आराम से. We'll just start in a few minutes, 1 or 2 minutes max. Uh, 211 हो गए हैं लोग अभी यहाँ पे. वन सेकंड सर, मैं ना इनको एक बार वहाँ पे अपडेट भी कर देता हूँ. लिंक उसमें टेलीग्राम ग्रुप में एक बार अपडेट कर देता हूँ सबको ज्वाइन करने के लिए.
हाँ जी सर.
Okay, so I think, sir, we should start. What do you say?
हाँ सर, कर दीजिए बोलिए.
हाँ, तो या कर देते हैं, मतलब स्टार्ट करते हैं. because people will be joining, no problem. And I think 4 मिनट हो भी गए हैं. So YouTube स्ट्रीमिंग पे जा ही रहे हैं हम. ठीक है, ग्रेट है एकदम, सब ठीक है. All good. Okay. So I think we have Dr. Shivani Desai also with us. Hi, Dr. Shivani. Good evening. How are you? Okay. Not audible. No problem. We'll call her later. I think she's stuck. She'll be speaking in 5-6 minutes. No worries. Okay, so sir, I think no problem. We will start. We are good to go.
जी सर.
Yeah. So hi everyone. Good evening. Am I audible to you everywhere in the YouTube? People, please write yes if I am audible at YouTube perfectly. Hi everyone. Am I audible? Okay, great. Thank you very much. Thank you very much. So yes, we will start. Will not take much more time now. Thank you.
Yeah, people are responding, sir. Yes.
Yes. People are responding. Yes, true. 1 second. I'm getting error, I think. Hmm. Sir, I got a call still and people are asking कि हम अभी भी registration कर सकते हैं या नहीं कर सकते हैं registration इसमें diabetic course में.
Okay, we can give them chance if they want after the session.
Yes, definitely. Then they can join anytime. They can join anytime.
That's
So
not definitely anybody to get the opportunity.
yes, because today is just our inauguration class. So what I'm doing right now is I'm keeping this. No, I think comments are not turned off. 1 sec. I'm keeping the Telegram group link in. We are okay. Okay, comments are how the comments are off. I'm not sure. 1 sec, guys. I'm just looking at the comments that I'm getting. But I think, sir, comments are coming on the YouTube, right? Why people are saying that comments are not? Okay, right. Yes, comments are not allowed. It's true. Okay, comments are now allowed. I think there was some glitch. No, that is actually the live chat is on, but comments were off. Yes, now you can comment. Now comments are on. Live chat was on, I understand, but comments were off definitely. Now it is off. Yeah, we are not delaying, Dr. Deepak. Yes, so we are just starting because today is the inaugural class, and yeah, 1 sec, just this one more response and okay. So everyone, good evening. Now I will start, and I will start with a story, and then I'll come to the course and our inaugural and so I'm a cardiology person. I did my PhD in cardiology, especially in heart failure, and I was very enthusiastic, and that is my research area and my area of interest. Actually, cardiology is my area of interest. But what happened after my PhD and some work in the hospital, KMC Manipal, after 5 years of work in cardiology, I had to leave because I have to start my own venture, CliMed Research Solutions. So I came out, but after 1 year in 2020, and I got a call from ICMR, Indian Council of Medical Research, that we want you on board to handle the registry study in India. They were starting the registry study in India on diabetics, on young diabetics actually, like people who are less than 25 years of age. So we have to study the diabetes in them, because the prevalence of those people is really increasing exponentially. You won't believe, I was looking at the trends in the starting, and now I was looking in the trend 10 years back. The trend was like total uh, prevalence of the young is around 4% in young people. Okay, and in 2020, after 10 years, it has increased from 4% to 10%, 4% to 10.5%. So this diabetes, actually India is the hub of diabetes, and it is not leaving even the young people. So that was a good opportunity from ICMR, and they were like very excited to take me, because I'm the kind of expert of registry studies in India. I did India's largest study on heart failure, and I did multiple other studies on such a simple such a similar kind. So but here I had the problem, because I had to change my research area of interest, because I was working in cardiology completely. Still I'm working in cardiology. I'm running the research trials and the registry study, but they wanted me to come on board for this diabetic uh, projects. So it was a good project. It was it is a good project. So I accepted. But since I accepted, I really feel that diabetes is a vast area, and people are getting more and more diabetes. They are getting sick. They are getting not only diabetes, but they are getting related complications like cardiovascular complications, nephropathy, and retinopathy, and there are multiple complications, sepsis, infections, diabetic foot, many things are there. So and in 2020, we have started one course. We actually ran the course for 3 months, basics of cardiac pharmacology. That was a grand successful course, and we got around 11,000 registrations in that course. So I was somewhere made my mind to come up with such a course in diabetics as well. And I and Dr. Rathor, sir, is the principal at Gitanjali Institute of Pharmacy. We have come up with this idea. I have come up with this idea, and sir has helped me. Sir has supported me, and Gitanjali University GIP has adopted this course, and they have given the affiliation from the university to conduct this course. And today, CliMed and Gitanjali Institute of Pharmacy, Gitanjali University, Udaipur, is conducting this course, this free 90 days course. The cost of this course, estimated cost of this course, is 3,000 rupees, because we are taking 12 classes in 3 months, and we are, calling the best from the India and from outside to take your classes. The experts who are experts in the field of diabetes, the clinicians, the pharmacy professionals, academicians, from the medical and pharmacy, both the fields. They'll be coming, they'll be taking your classes. So, but as I really believe in this, the call of free education, or education at least price. I have waived off, or we have waived off. We plan to waive off the 100% tuition fees, and we just came up with the 99 rupees of technical charges and certificate charges and exam fees. And you won't believe, guys, I'm really happy to announce and say that we got 1700 plus participants. Even they are paying 99 rupees. 1700 plus participants are there on board, and we are getting queries and we are getting requests that we still wants to join this course. 1700 plus. So this is now from my side for about the course. Now next thing, one very important information for all of you. We kept Telegram group link in the description of your YouTube channel. We have sent 2 emails with Telegram group link. We sent multiple reminders to all of you, but you did not join the group. See why I am telling you to join the group, because sometimes your emails are not correct. Sometimes there are the technical glitches in the emails and you are not getting the emails. So it is very important for all of you to join the group, where you will get all the informations about the classes, about the recordings, about about the speakers, resource persons, about the timing changes, and whatever are the informations we will update in the Telegram group. So right now or after the class, immediately, everyone, all 1700 plus participants, I request all of you to join Telegram group link. I mean Telegram, group, and the link is there in the description of this video in YouTube. In this live transmission also, you can find the link in the description. Please join that, because only 700 people have joined the group, till now. And that is just 40% or 35% of the entire participants number. So please join it. Okay. And second thing is, you all please subscribe to the channel. And why it is subscription, because sometimes when we go live from Zoom to, this is a technical thing what I'm telling, why I'm asking you to subscribe the channel, uh, not for other reasons, but why I'm telling is because sometimes there are the glitches when we go live from Zoom to YouTube, or Google Meet to YouTube. There are the glitches in encryption. Okay, there are the glitches in encryption, and we sometimes directly cannot go with the link whatever is provided to you. So sometimes we have to skip that link and we have to directly go live on YouTube. So in that case, if you are subscribed to the channel, you will get notification that your classes has your class is started. Okay, your classes has your class has started. So you will get that notification. That's why we are requesting all of you to join the subscribe to the YouTube channel as well. These two things are important from your side. Okay, to do it right away or after the class, but please do it. Okay. And then what we are going to cover, that is very important part, that what we are going to cover in this course. This is a 90 days course. And first of all, I would like to tell you about this schedule, that we have planned to conduct the classes only on Sundays, because there are 12 plus classes. Actually, first we planned about 12 classes, but now it is going to 13 or 14 classes. But no problem, we can increase the duration of the course. That is also not a problem for me. So there are 12 classes right now what we have planned, but it may go to the 14 classes as well. So we have planned till now the classes only on Sundays evening, 5 to anytime 6 or 6:30 or 7, depends on the resource person, how much long he is taking the topic. Okay, he or she is taking on the topic, right? So the classes would be 1 hour to 2 hour, anything. So 5 to 6:30 or 7, you have to be in the class. And 60% of the classes, because I understand that you all have the busy schedule, 60% of the classes you have to attend must. But I request all of you, because you have joined the course and you want to learn, join every class. It is kind of things where you will learn, and where you will learn live from the experts, live from the clinicians, and our academicians. They will teach you live. You can interact with them through YouTube, through your comments. You can ask the questions. They will be happy to answer your questions, right? And then my team will be taking care of that whatever you are writing in the YouTube, whatever you are trying to communicate, that will be going to the live resource person, and they will be answering your queries. All the queries, every query will be answered. Okay, so that's a great chance to learn from the live experts as well. And the next thing is that this is a comprehensive course. Now I'll come to the course syllabus content. This is a comprehensive course where we are covering everything. We have tried to cover everything, means everything in the diabetes. Okay, everything in diabetes means we have divided this course into 5 sections. First is basics of diabetes. Basics of diabetes, you must have seen this in the course brochure also. Basics of diabetes, where you will learn history of diabetes, history of insulins, types of diabetes, and what are the biomarkers of diabetes, what are the diagnosis of diabetes, whether it is a biochemical investigations, or any other investigations. Okay, all the investigations of diabetes and related complications, everything you are going to learn in that. And in types of diabetes, the second section, you are going to learn about type 1 diabetes, type 2 diabetes, gestational diabetes, and then young diabetes, which is now my research area. Young diabetes, you are going to learn about LADA and MODI, latent in autoimmune deficiency, diabetes, and then all other types of young diabetes as well. MODI and chronic diabetes, or chronic pancreatitis, all the things you are going to learn in this. Okay. And then in the diabetic macro and micro complications, you are going to learn about nephropathy and retinopathy and related cardiac complications, and neuropathy and diabetic ketoacidosis, which is very important to learn. Diabetic foot, we are going to talk about diabetic infections. In that, tuberculosis and sepsis are more important to learn. Okay, because many people in diabetics, many diabetic people, many diabetic patients, they get sepsis and tuberculosis. So we are going to include these things in these classes in your curriculum as well. And then we'll come to the diabetic pharmacotherapy. We are going to talk about the history of insulin and all the types of insulin, whether it is short acting, long acting, intermediate acting, pre-mixed, regular, whatever is there, or new analogs. Everything will be covered in the insulins. And then we are going to talk about all the types of oral hypoglycemic agents, whether they are new, traditional, or whether they are old, traditional, or very new, you know, uh, very new for the diabetics. So you will get to know about all the oral hypoglycemic agents along with their clinical trials, their updates, everything. And then there are the vaccines which are coming for diabetes 1 and other young diabetes. So we are going to talk over the vaccines of diabetes as well. Okay. And then in the fifth section, we are going to talk about the recent updates, which is very, very important for all of us to, get updated and to, understand everything. In that, the first very interesting topic is, COVID-19 and diabetes. You must know that, or you must have read that somewhere that, people are getting a new onset of diabetes after COVID. And the incidences has been increased by 20 to 25% in the people who are getting diabetes after COVID. So that is very important to understand the correlation between COVID-19 and diabetes. And in that, you are going to, we are going to talk about recent clinical trials and all the updates. And the, very interesting part is that every faculty will be talking about the live cases and about their cases, how they are handling the cases. And there'll be few live case discussions as well, where, you will learn all the, all the scenarios, how these cases are being handled in the hospitals. And then we are talking about patient counseling and especially the clinical pharmacist perspective or pharmacist perspective in the diabetic pharmacotherapy, and how they handle the situations and how they handle the medications. So these are the things you all and we all wants to learn. We all want to learn, and these are the things we all are we are going to cover in next 12 weeks, in next 12 modules, 90 days. So please be with us and try to come up for all the classes and learn from the experts. And best wishes for the next 90 days journey. Thank you very much. And now I will invite Dr. MS Rathor sir. He is here with us. He is our the collaborator and the principal of GIP, the Gitanjali Institute of Pharmacy, Gitanjali University, Udaipur. And sir is very interested and very enthusiastic, and he was very excited when we were starting this course and planned this course. And you must have seen our this launch of this course. If you have seen, we have called the people from different universities, vice chancellors and chancellors, and many people came to the inaugural part also, the launch part also. That launch video is also there in our YouTube channel, so you can visit that also. So Rathor sir is here. Over to Rathor sir. Thank you very much, sir, for the opportunity and for joining hands for this course.
Yeah, thank you, Dr. Ajit. I'm audible.
Yes, definitely, sir. You're audible.
So, good evening to all the participants and the resource persons available here. I can see Dr. Ajit is there along with Dr. Shivani. So, good evening to you, sir. And regarding this course, just let me share you that one day we were talking with Dr. Ajit, and Dr. Ajit was just sharing that, sir, we are planning for this diabetic pharmacotherapy course, and we are also running a PharmD program here at our institute. So initially in my mind, I was that okay, this would be certainly useful for my students. Along with we are medical university, and at our university we are running courses of medical sciences, nursing, pharmacy, physiotherapy. So I thought basically diabetes is now a big problem of the society and healthcare. So that this is certainly going to be useful for all of them. So I requested Dr. Ajit that let's join hand, and then in collaboration with CliMed Research Solutions, the Gitanjali Institute of Pharmacy should also be the part of this course. So just later on, we had a round of discussions, and then ultimately this course came to you in this current shape. So thank you, Dr. Ajit, for joining hands with us. And certainly, I'm very sure that this course is going to helpful to the all participants, to the all learners, and then the resource persons are renowned and they are expert in their fields. So that
Yes,
this is
definitely.
going to be a very good opportunity to learn about the diabetes, and then putting these concepts and principles that you learn into practice wherever in whichever segment you are working. So I am my best wishes are there, and it's very good to learn that more than 1700 participants have crossed this. So basically, Dr. Ajit, let me share you that this sort of course actually we are providing that Dr. Pramod from Kadila also, and the other vice chancellor was also saying that how you are doing this thing, because
Yes,
arranging such resource persons and organizing such things, let it be online, but still it is you can find out on the internet that many this sort of courses are charged very high, and the level
yes.
of resource person that you see
You,
that will come across
you
with
got,
you. So
yes, sir.
certainly this is going to be, and it's a really very useful activity and a useful course in the interest of the students, in the interest of the science, in the interest of the diabetes care.
Yes,
Particularly, this is
yes.
going to be a very good benchmark for it. So
You know,
this is all from me, and then we extend our full support for this
yes.
diabetic pharmacotherapy course. And I
Thank you.
also have there with me, and certain students are also there. So thank
Thank
you, Doctor, for giving me the
Thank you very much,
opportunity
sir. Thank you
to
very much.
interact with
Thank
you.
you very much. Yes, yes. So, guys, I'm very excited to announce our, resource persons here. We have, I have a list with me. We have Dr. M.M. Prabhu. He is MD, and his professional journey is around 25 years in the medicine. He is the professor at Kasturba Medical College, Manipal. We have Dr. Cynthia. She is Associate Professor at Department of Medicine, Kasturba Medical College, Manipal. We have Dr. Nand Krishna Bhatt with us. He is MD and DM in, medicine, and he is specialized in the diabetic care at Manipal. And he has the 10 plus years of experience. We have Dr. Sudhakar Rao. He is MD and DM in cardiology, Associate Professor at Department of Cardiology, and he is the specialized. As he is specialized in cardiology, he will take our cardiovascular complications in diabetes. We have Dr. Shivani Desai. She is with us, so I will invite her after this list. So she is here, and she is a researcher and working at Department of Pharmacy Practice and Pharmacology at DY Patil Institute of Pharmaceutical Sciences and Research, and she is working on the diabetic vaccines Okay, vaccines for diabetes. We have Dr. Khera from, he's the in charge of pharmacy and associate professor at Lovely Professional University, Fakwara, Punjab. We have Dr. Tarun Rashe. He is PharmD and our deputy director as well, and he's a very, what we say, keen researcher of diabetes. So these are just the people. We have called some more endocrinologists who will be talking on, and some more clinicians who will be talking, to you in your classes. So we have around 8, faculties who will be taking your 12 classes, guys. So be with us definitely and learn, and try to learn everything, and try to ask more and more questions. I always tell this: try to ask more and more questions, try to interact more and more with the clinicians and faculties and academicians, and ask for their experience, how they are dealing the cases, how they are handling the cases and handling the patients in the hospital, because they will tell you the live experiences, and live experiences far better than the theoretical things what we learn from the internet or what we learn from the books. Okay, that is somewhere I always feel that is just a 30% of the knowledge, but 70% of the knowledge comes from your live experiences. Your when you are going live, you are seeing the patients, you are looking at the patient charts, you are looking at the medication charts, you are looking at exact patient's conditions, what are the complications, and how drugs are distributed for those complications, how drugs are prescribed for those complications, and how they are dealing with the biochemical investigations, how they are dealing with the investigations. So live, you can connect to our speakers, resource persons live, and you can ask questions, and I request you to ask more and more questions. And as sir was talking about the cost, from last year only, I was seeing that BMJ, British Medical Journal, they are conducting some course in India on diabetes. They have lesser syllabus than our subject, and their charges are 1.5, 1.2 or 1.1 lakh for the course. They are giving 1 or 2 months of live experiences in the hospital as well, but their charges are really high, 1.1 lakh for this course, and online classes. That complete course is online, complete classes are online. So the cost, and we are not charging at all, so that is just about the cost. And we have Dr. Shivani Desai. Hi, Dr. Desai. If you are audible, if I'm audible and you can speak. Actually, Dr. Shivani is.
Yeah.
Hi.
Hi, Dr. Singh. How are you?
I'm good. I'm good, Dr. Desai. So Dr. Desai is, as I'm telling, she's working on, vaccines for, diabetes, and she'll be taking a few of the classes for you guys. So yes, Dr. Desai.
Yeah. Actually, I am really excited to be a part of this very big event. And I was already there with you all during the inauguration.
Yes.
And it is a very big deal to have such a big course at such a big platform. So I'm delighted to be with you, and really excited to share my views on the session, and of course to know a lot of things from different eminent speakers which you have taken the names of. So it will be a good experience for me as a learner and as a tutor. Thank you.
Yes, thank you very much. So guys, if you have any questions, we can take up the questions, and we can go ahead with the we can conclude today's class, and your classes will be starting from the next week. Your first class will be on next Sunday, everyone. So okay, let me check the comments. I'll just see the comments once, and I'll try to answer. Okay. Regular timings are 5 to 6:30 on Sundays. Yes, recordings, as we are going live, these recordings will be there for you. You can watch these recordings anytime. These will be restricted only for you. You can watch these recordings anytime. Okay. Telegram link is there in the description. If you check out now, it is there in the description of this course. In this live class, description of the live class, you can check. See, many people are complaining that they did not get any email, but I have checked, whoever is complaining, their email is, mentioned wrongly. They have, by mistake, they have written their emails, they have filled the forms wrongly, their emails. So this is, I think, there may be some technical problems from our side, but your emails are also not correct. So that's why I always tell people in all the courses, I always ask for the email twice, because sometimes they do not write the email correct in once. But that's why I'm asking you to join the group directly now. Please join the group. There is no such course material, there is no such study material. You will get all the recorded classes. Okay, Shruti, what's your family program? Will you please illustrate after this lecture? Okay, that's different. Telegram link. Okay, I'll just share this Telegram link here in the YouTube comment, so you all will get it, and this is there in the description part also. Okay. List of the topics. Okay, list of the topics. Okay, we will share the list of the topics with the faculty names and with the timings by tomorrow in the group only. Okay. Yes, so yes, about the certificates and all, there are the queries. So see, don't worry about the attendance. We have people, we have very, very good, data analyzers who will take care of your attendance. They will come to know who is attending, who is not attending, who are attending. They are taking care of your attendance. So don't worry about the attendance from your side. Just come and join the class. They will take care of that attendance. My team will take care of the attendance. Okay. And certificate, for the certificate, yes, there are the two conditions. At least 60% of the classes and 60% marks. In the last assessment, there will be one test, because these courses are coming under the NEP 2021, New Educational Policies of Government of India, skill development program. So we have to conduct the assessment, and based on the assessment only we have to give the certificates. So you will get the certificate after the test, and in that test you have to get at least 60% of the mark. But the test is completely online, and there will be 20 to 25 questions, all MCQs. You just have to select the out of multiple choice questions answers. Okay. Okay, what we do, one sec. Okay, there is a very interesting comment. Okay, why we are not taking this classes on Zoom? Okay, so suggestion is good, but there are a few problems. Yes, our exam will be online. What we do for better learning other than your live classes? Yes, definitely, it's a good question. You can see, you can go to the specific sites like American Diabetic Association, and you can read from the guidelines. You can download the different guidelines, guidelines like for European guidelines and American Diabetic Association guidelines, and please read those guidelines. Those guidelines are very very explanatory, and you will get everything. So if you are reading those guidelines, it is very you will get majority of the things, how to read, what to read, and what to understand. Evidence based learning, we call it. Okay. Today you're not, no, today there is no class. Okay, is there any researcher from preclinical research? Yes, Dr. Shivani Desai is the researcher who is working on the preclinical data as well. No, classes will not be on every day. These are only on Sundays. Recorded classes will be there, yes, but try to join live classes, guys. Your attendance will be counted only if you're joining live classes. Yes, every Sunday 5 to 6:30. Okay. We'll take this suggestion definitely. Yes, there is exam, Ria. There is an exam at the end. Multiple choice questions. Go to the American Diabetic Association guidelines. Those are, the great thing to learn. Okay, so I think we have covered all the, sessions. We have covered all the topics. If you have any questions, you can ask. No, see, that's why I'm asking. If you are subscribed to this channel, you will get the notification directly at the time. But we are creating the links for every class, and that link will be circulated in your to you in the emails and in the group. That's why I'm asking you to join the group. All the details about the classes and everything will be updated in the group. So please do that. No negative marking, yeah. Lokesh, no negative mark. Can we register for this course today? Of course, you can register for this course. No problem. Okay, so and okay, there is one very interesting comment. Very interesting comment that are we going to get job prospectus or offer related to our topic? See, this is not a course, or here we are not providing the jobs after this course. But the thing is that this will help you learning all the diabetes. Okay, this will help you learn all the diabetes. And this is not a degree. So as it is written in the brochure also, this is not a degree certificate. This is just a 3-month certificate course, which is actually we are conducting to make you skilled in the diabetes and diabetic diagnosis, diabetic treatment, diabetic drugs, diabetic all the insulins and all the therapies, right? So this is to make you skilled in the diabetes. No job placements. No job placements. And yes, no PPTs as well, because PPTs are the discrete decision and copyright material of our speakers, so they do not share the their own material with us. They do not share their material with us because that is the copyright material. We cannot share the slides with you. That's why we are giving all the live recordings and classes. You will get the credits definitely. Okay, thank you. So thank you very much. I'll not take your much time, guys, today. So yes, take care, and we'll see you in the next class. Next class is on next Sunday, 5 p.m. Yeah, you can take up notes, you can write up notes, you can make your own notes, no problem at all, right? Yes, it will be posted in the Telegram. Okay, so thank you guys. Thank you very much, Mahendra sir, for joining. Thank you, Dr. Desai, for joining, and please take care. Yes, we'll see you, and I think we are very good to start this course now, and we are going to start, and we will start from the next week, sir. Thank you everyone. Thank you, sir.
Thank you, sir. Thank you.
Thank you, sir. Thank you. Take care. Yes, sir.
Have a nice day. All the best to all participants.
Yes, thank you. All the best to all participants. Thank you, Dr. Desai. Take care.
Yes, thank you, Dr. Singh. Dr. Mahendra Singh.
Yeah, ma'am.
Dr.
Hello,
Desai
sir.
is actually recovering from the COVID.
Yeah, but I'm fine now.
Okay, great.
Okay, sir. Thank you, Dr. Rathod, sir. Ajit, sir. Bye.
Bye. Take care. Thank you. Thank you, everyone. So we'll take off.